Hi, I'm Nicole, and on this episode of Tech Trends, we'll be talking about robotic surgery. What is it? Robotic surgery is using robots to perform surgery. Depending on the different types of robotic surgery, there's different levels of control the robots can have. There's 3 types: supervisory controlled, which is the most robot controlled; telesurgical, which is also called Da Vinci, and the surgeon controls but the robot performs the functions; and there's shared control, where the surgeon does most of the work but the robot does help. Features: there's robotic arms that have scalpels, scissors, and a high-definition camera on the end. And there's a picture of the robotic arms, and it shows how precise they are. And at the end picture, it's comparing it to a penny and a paper crane. There's a high-definition viewing console that the surgeon looks through. The robotic arms can move 360 degrees, which is more than a human wrist, so it allows them to get into more places and do more. And if they use a shared control surgery system, which lets them have a lot of control, the robot still provides resistance on the surgeon to help. As I said before, there's different types of robotic surgery. Intended uses: robotic surgery helps surgeons perform surgery quicker and easier. There's a quicker recovery time and less blood and pain for the patient. Certain types of surgery, especially cancer surgery, lessen the chance of organ failure. And there's smaller scars, if any. Here's a picture of the incision normally used, and here's a picture of the incisions you need for robotic surgery. So as you can see, they're a lot smaller, which means there's less scars and smaller scars. How does it work? Supervisory controlled. The surgeons input the data into the robot, and the robot then performs the functions. There's points on the body of the patient that match up with images from the planning stages of the surgery. The robot and patient are carefully positioned by the surgeon so that everything works out. And as I said before, it's at least controlled by the surgeons out of the 3. Shared control. The surgeons need to program the robot again, and the closer the surgeon gets to the tissue, the more resistance the robot pushes on the surgeon's wrist. And if the surgeon gets close enough to the patient's soft tissue, which is easily damageable, the robot locks itself. There's an equal sign since they're equal control. How does it work? Telesurgical. With telesurgical, there's a viewing console right here, and there's the tools with 3 to 4 robotic arms on the end. The screen that he's looking through shows the surgery site and 2 to 3 instruments. The console sends signal to the robotic arms, so whenever he moves the joysticks, the robotic arms move. There's a picture sent whenever he moves the joysticks from here to here. And since he moves the joysticks so frequently, there ends up being a video. What's so innovative about it? Once again, it's using robotics, which is new to surgery. The surgeons can see in high definition, which lets them get closer up to the patient. There's different types, which means different levels of control. There's many advantages over traditional surgery. And there's another picture of the robotic arm showing how small it is. Future uses for robotic surgery. It's being used for more and more types of surgery already. It's a safer alternative to cancer surgery, and they're trying to get more and more cancers they can apply it to. It's becoming more used by surgeons. It's still a little used because it costs a lot. Like I just said, if they could find a way to make it easier to make, it'd be a lot better. And right now they're trying to make it so the robotic arms can have a touch sense. There's some hands for touch sense. My opinion. I think it costs a little too much, but it's innovative and important to medical technology. It helps save lives, and there's many advantages to the surgeon and patient. It's more effective than other types of surgery also. Overall, I think it's a great new technology.